Hi, my name is Desi Porter, and I will be performing a trach suction video. So for my video, we will, like I said, be doing a trach suction. Before I begin, I would make sure that I had the order for it, and that the order was correct, that the order gave the right time and place, and that time and place, and that the right size for the trach suctioning. I would also check the oxygen that they were on, how many liters. I want to check if they're on an ambu bag or if it's just continuous oxygen. I would check for pain medications to see what kind of medications they were on, or if they needed any, or when the last time they had it. I would also check lung sounds and O2. I would check to make sure that what I'm finding is within range, or if I need to declare it an emergency. And then I would gather my supplies and head to the room. So then, once I've headed to the room, I would of course knock, walk in. I'm assessing the room for safety and making sure that the people that are in the room need to be in the room. If not, I'd ask them to leave. I'd also provide privacy by closing the door and or closing the curtains, which I have done. So then, now we shall begin. Okay. Hi, my name is Desi, and I will be performing trach suctioning right now. What that means is basically that you just have a lot of mucus, and so we're just going to suction that right out, okay? If you need me to stop at any time, you can raise your hand as a stop sign. I have checked to be sure that that is appropriate. Like if they had an issue with raising their hand, that I would come up with an appropriate signal to stop. But my patient can raise their hand, so that's what we're going to do. Can you go ahead and show me that you can? I would have checked name and date of birth. I'm not sure that I did that, but I would have checked that before I began with the orders and with the MAR to be sure that that was correct. Continuing on. Yeah, so that's what we'll be doing today. Can you show me that you can raise your hand as a stop sign? Okay, thank you. All right, so now I'm going to, they're already at an appropriate height and level, but I would raise the bed to appropriate level and raise it to a semi-Fowler's position, at least 45 degrees, because my patient is conscious. Of course, I'd provide the drape over. I would also put on a mask and a gown for myself. However, so that you can hear me, I'm going to leave the mask off. The mask will be used as my oxygenation. We're going to pretend like it's my oxygenation at this time. So I have my gown on. Of course, I did hand hygiene when I came in, but I'm going to perform it again now that I've touched things and I've raised the bed and I've lowered the side rail. All right. So hand hygiene. All right. So now that you're already set up, I'm going to go ahead and sterilely open my package. Aseptically open my package, but making sure I don't touch the inside because that will be sterile. Okay. So what I'm going to do is I'm going to go ahead and take out this here, only touching the outside and opening it up, getting a nice little lock on it. Of course, before opening my package, I checked that the expiration date and that it was sealed and closed. And then, making sure as I go along, I'm checking everything to make sure that it's sealed and that it is sterile. So then I'm going to check this, make sure that it's within its expiration date and it's correct. I'm going to put the label to the palm of my hand. Go ahead and open it up. Pour some saline. A little bit. Close and set aside. Alright, and now I'm going to go ahead and open up my gloves.
The patient is in the correct position and the semi-Fowler's already provided privacy for the patient.
I wouldn't go over my sterile field, but so that you can see the gloves being put on, I'm going to go ahead and kind of scoot the catheter over.
So this is a sterile procedure, so we will go ahead and get our sterile vessels. The ostomy care kit.
I'm touching only the outer cuff.
To open this, we would pull away from us like this, and I would just grab the top here.
I'm going to remove these gloves. Go ahead and I'm going to remove these gloves.
So you just do that. You know, she was telling us.
I'm also going to move this bottle.
But see, in the video why she, they did it right over.
Alright, now I'm going to place my hands inside the cuff of this glove to keep sterility. And then place my hand in here, not touching the other glove.
Okay, now that we've performed suctioning of the trach, we are ready to.
Alright, so now that the inside of gloves, I'm going to fix the pinky on both because they're both sterile.
This is a sterile procedure. Of course, before I begin, I've already identified the patient. And
Being sure not to touch the cuff, just only the insides of the
sure
gloves.
that the patient is in a semi-Fowler's position and there is privacy provided.
Okay, so now I'm going to go ahead and take the catheter out because this package was inside the sterile package and it's still sterile. I'm going to grab this. I'm going to discard the outer package in the trash can. I'm going to take the catheter in my dominant hand and the suction in my non-dominant hand. This hand will become clean. So I'm going to go ahead and wrap this around my hand to ensure that the catheter stays sterile.
We will start by opening the sterile kit, and we want to pull that away from us. Go ahead and discard that.
Before I began, I would have checked to make sure that the catheter, the suctioning machine, that is a portable machine, was between 10 and 15, and checked by occluding the end of it just to be sure that that was correct, and turned it on at that point. However, because you need to hear my voice, I'm going to leave it off. At this time, I would connect to the suctioning machine. So it is still, my hand is now clean and connected it. I'm going to roll away from it so it, don't lose, and this was still within view. It's still in front of me. So then my suctioning machine is on. I'm going to test the suctioning up some of the saline. Alright, so it is suctioning, and it is suctioning at an appropriate level between 10 and 15. Alright, so now I'm going to take my clean hand, I'm going to wrap this up, take my clean hand and ask for about 3 to 6 good breaths. I'm checking to make sure that he understands that one last time and that we have our signal down. Okay, so I'm going to set this aside, the oxygenation, and I'm going to advance the catheter in without suctioning at an appropriate distance. Alright, and on my way out, I will suction, and I will be inside suctioning for no more than 15 seconds, and then I will put oxygen back on and hyperventilate, making sure that this hand remains sterile at all times. Go ahead and breathe. How are you doing? I'm reassuring and making sure that there's nothing that she needs. Okay. At this time, I would do it again. I can do this process for no more than 3 times. I would be sure to give 30 seconds to a minute in between each attempt to remove the suctioning. Remove the.
And we're going to remove the inner
So
what we do
give
is we grab
30 seconds to 1 minute in between each time suctioning.
and then pull that out. And what I'm going to do is place that.
All right, I'm going to remove this.
And while that is
I'm going to say that we've done it once and that it was sufficient. How I would know that it was sufficient would be that I would listen to the lung sounds. I would do an O2 sat. I would do a full assessment to ensure that we did get all the mucus out, having him cough in between each attempt during suctioning. Okay, and then so we've gotten all the suction that we need. I would go ahead and make sure, in between each attempt as well, you would make sure that it was still suctioning by dipping it back into the saline and then wrapping it back around your hand. All right. So it's been a minute, so I'm going to go ahead and advance again. Not putting my finger on the occlusion until I'm down, and then occluding the port and suctioning as I come out. All right. So that's the last time we were going to do that. Like I said, I would assess the lung sounds and the O2 to verify that we did get the suctioning, having him cough in between each time. I'm going to go ahead and put that back. Turn off the suctioning machine. I'm going to go ahead and take this inside the glove and remove my other glove. Before I would have taken off my gloves, I would have taken off my
No, I'm saying if I don't sit it here,
No.
where would I?
I'm right. Take off the gloves. I would go ahead and discard the gloves in the correct way. Taking off my mask and my PPE equipment. And then
Oh,
I'm going to go ahead and take this off. I'm going to perform some oral care.
We're going to go under the plate here, same thing, working from
Right.
the inside out.
And then I would gather my supplies, throw what needed to be thrown away, return my resident or patient to the appropriate level, a safe level, down in the bed, and returning her to her desired level of sitting up.
Being careful not to
And then I would go ahead and document all of my findings and my assessment once I've completed the procedure. All right, thank you. So I would have made sure to do a lung assessment prior to the suctioning. I would have made sure to put my PPE on after explaining the procedure and ensuring that I was in the right room, and I would have suctioned the mouth after suctioning the trach and before finishing. Alright, this will be tracheostomy care and cleaning. So to begin, I would check for the order, make sure I understand which type of catheter or trach we are dealing with. I want to assess the level of consciousness, when the last time it's been cleaned and suctioned. For this video, we're going to assume it was just suctioned, so they should be able to breathe. We're going to make sure that if there's any pain medication needed, that the pain medication has been dealt with and taken care of. We are also going to check and make sure that I'm not interrupting any other procedures or medications at this time, that my assessments will be within range of what's been going on, and that there's proper, I'm just going to adjust real quick, there is proper oxygenation and what type of oxygenation we'll be using. For this case, this is my mask that I would have put on. However, we're going to pretend that it is oxygenation at this time. Yes, and so that's how we're going to start. Okay, so then I'm going to gather my supplies once I've looked at the chart and head to the room. I'm going to set my supplies down on the bedside table. Of course, when I've picked up my supplies, I checked for sterility, making sure it was closed, that the expiration date was proper, and that I had the proper equipment, as well as sterile saline and gloves. So I'm just making sure that everything was closed and was within the expiration date. Alright, so then I've gathered my supplies. I've come to the room, knock, 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 provide privacy. Hi, my name is Desi, and we will just be doing a change of dressing for you. So, but before we begin, I just want to make sure that I'm in the right room. Can you give me your name and your date of birth? And I'm checking that with what they say, with on the bracelet, which is within their orders. So then now that I have the right patient, the right room, I am going to go ahead and begin. So like I said, we will be doing some dressing change. Also, I would have another nurse with me for fixing the ties and being able to hold the faceplate down for me. But in this case, it'll be just me. So we're just going to pretend like I have a second nurse. Yeah, so we will be providing some dressing change real quick and then just cleaning around and making sure that you're all fixed, okay? All right. So now to begin, I'm going to get some hand hygiene. Raising the bed, semi-Fowler's position. The bed is raised. I'm letting down the side rail. All right. I'm putting on proper PPE equipment. If needed. And then I use the gown for tracheostomy care because things can fly out when coughing, and I would have the mask on just to ensure that if there was any cough, anything flying out, I have my gear needed. All right, I'm gonna drape my patient. Just to ensure that nothing gets on my patient. Okay. And then I provided privacy. Alright, so to begin, I'm going to hand hygiene. I'm going to put on clean gloves. They're sticking. So 16 gloves. I'd have my second nurse hold down the faceplate while I removed the dressing around. Made sure that the ties are untied, and that's why she was going to hold it down and ensure proper placement. Okay. Putting back oxygen if needed. Alright, so now that I've got the old dressing off and that we've got her holding down the proper placement for me, I'm going to go ahead and remove these gloves. Dispose of them. Hand hygiene, preferably I'm going to actually wash my hands, but for this purpose, hand hygiene. And then I'm going to open up my first pair of sterile gloves. I'm going to go ahead and move this around. Dispose of this. Set my first set down. I'm going to open them up. Alright. I'm going to pinch the outer cuff. Still holding the outer cuff. Touching the inner cuff. Draping my hand in the inner cuff.
So let's re-clean, guys. So
okay, so the inside of the sterile to sterile. I'm going to fix my fingers.
So I will
order to
sterile gloves. I will
Let it remain sterile.
take it and eat it.
I'm going to pick it up from the inside. Discard
then I will
to the side.
put on my sterile gloves so that I can
This would have been opened before because the outside is not sterile, so this would have been opened. So I would get a new pair of gloves. I open it, new pair of gloves, sterile gloves, re-glove. Okay, sterile. So then I have my drape. So I'm just going to open up my drape, touching only the outer corners, even though my gloves are sterile. I'm just going to set it down, shiny side down. Being sure not to go over it. So what I would have done is not that. I went over it. But I'd opened it and laid it down. Okay. Now I'm going to go ahead and take out my second set of sterile gloves. I'm just going to open them up because they're still sterile. And then I'm just going to drop them to the side. And then I'm going to take out my supplies. The inside of the package is still sterile. So I'll be using that a little later. I'm going to place this, drop it onto my sterile field, within my sterile field. And then I'm going to take out these and place them aside.
Her towel, listen to her lung sound. So I'm going to go ahead and put her towel right here on her shirt. That way it's not too close to that area. And then I'm going to open up this container. The towel is perfect. And then I'll make a
Separate these. Take these out. And this is my hydrogen peroxide. So I'm going to go ahead and open this. And I'm going to pour my hydrogen peroxide into the first open container and discard. And I would take this, open it. So that's the hydrogen peroxide. Then I'm going to take my normal saline, which is on the side here. And of course I've assessed it already for expiration. Place the label to my palm, open it up. My hands are no longer clean because I just touched this. Sterile. So I'm going to open it from the side and I'm going to pour some sterile water in. Alright, close. So now my hands are no longer sterile. I'm going to go ahead and set this down. Out of my sterile field. Still not touching my sterile field. Remove my gloves. My nurse is still holding my trach plate for me. Oxygen is still going if they have oxygen. Discarding these into the proper waste receptacle. My gloves are on the side out of camera view, so I'm just going to move it into camera view, but I would not break sterile field typically. So they're still in here, but for the video purposes, so that you can see me sterilely put on my gloves, I just place it over here. Touching the inside of the cuff. Only the inside of the cuff. Having a little difficulty putting them on. Alright, only touching the inside of this glove. Whew. Hiding my hand inside the cuff of the glove. And only touching the inside. I'm still only touching the inside. My hand was touching the inside of the glove, but this hand remains the outer portion. Now that my gloves are halfway on, I can go ahead and fix it sterile to sterile. Being sure not to touch the cuffs of only the palms or the insides. The cuffs are no longer sterile. So at this point, my cuffs are kind of rolled up. I would just take these off and get a bigger glove size. So I didn't touch, but I need to roll these down. So I would have gotten a bigger size, but the size that came with the kit is medium, so we're going to work with that. Okay, sterile gloves are on. I would grab it from the inside, not from the outside, because I touched it. Grab it from the inside and discard. Again, this wouldn't be on my sterile field. This would have been off on the side, but just for visual purposes. Okay, and then I dropped it in the brace receptacle, being sure not to drop my hands below my waist. So now my field is set up. My dressing has been removed off. Okay, I'm going to go ahead and begin to clean. I would have, my nurse would be clean. My second nurse would be a clean nurse. She wouldn't be sterile at this time. She would have removed the port for me. So she would have removed this for me. I would have dropped it into the hydrogen, and then she would have dropped it into the hydrogen peroxide to let it get clean. From the hydrogen peroxide, I can clean it now by grabbing and cleaning, scrubbing, cleaning, scrubbing. Okay, discarding this because it is no longer sterile. Dropping it into the saline for a rinse. Okay, and then I am going to take the my dressing into the hydrogen peroxide on this side, or into the normal saline in this cup. Wiping outward with one and discarding. Wiping outward, discarding. Cleaning around the inside when my nurse would have taken this off, cleaning around the inside, and then putting a proper dressing back on. Around. So my hands are no longer sterile. To put the dressing on, putting the face paint back on, getting on another pair of sterile gloves, but for the concept of time, grabbing the inner cannula and placing it back in. And then now I can remove my third set of sterile gloves, clean up, help my second nurse properly tie down the cannula. When I was cleaning and looking at it, the tracheostomy, I would have looked for color, any signs of infection. I would have looked for any signs and symptoms of infection, color, if there was any drainage, if more suctioning needed to be done. And then now that I'm done with all this, I'm going to assess lung sounds and O2 to be sure that you can properly breathe. All right. I'm assessing pain as well at the end of this to ensure there's no pain. If there is pain, getting proper medication as ordered. All right, I'm going to go ahead and take this off and clean. All right, cleaning up my supplies, putting the patient at a proper level back down, and whether they want to be sitting up, making sure that I put back on the oxygen if that was needed, and then going and documenting afterward. Thank you.